My name is Andrew Goldberg. I'm a physician scientist at the University of Maryland School of Medicine in the United States. And I head the aging program, conducting research in the elderly, looking at lifestyle, exercise, nutrition, and behavioral modification methods to improve the health of older Americans. Aging per se is personalized medicine because what we deal with is the patient as a whole, from the molecule to the tissue, to the brain, to the behaviors, to the things they do on a day-to-day basis, trying to improve the quality of life. So we go from the patient's symptom to the tissue, to the gene, and back, trying to develop integrated ways to improve their overall health. I like to use the term integrated medicine, where we take the perspective from the patient, working backwards from the patient to the cell, and trying to incorporate what we find out at the patient level to tissue mechanisms for disease, and then develop therapies to modify those disabilities. I think the biggest challenge that we will face is taking the molecular biologist and the findings at the level of the gene and translating it to the clinician, so that the clinician can then understand what they're talking about and prescribing or modifying those findings and translating them into a method of treating our patients more effectively to make their lifestyles better, improve their health, improve their well-being and quality of life. So conferences like were held these 2 days here in Rotterdam are so very important for bringing diverse specialties and clinicians, physicians, molecular biologists, geneticists together to talk about, for example, women's health. What are the needs? How do we deal with them? And then what could be the causes of these conditions that then can be targeted to perhaps get more effective treatments? I would have to take a pediatric disease that was present and disrupted the lifestyle of the child, the family, and the society. And I would choose diabetes as that one disease, and the person who could cure diabetes and would be the person who perhaps should win a Nobel Prize. Similarly, from personal experience, my son is a pediatric neurologist, and he chose pediatric neurology because he wanted to cure epilepsy. So that I would probably put epilepsy right up there with diabetes, having seen how devastating epilepsy can be for a child, for a family, for the society that family and that child live in. So Liesbeth and Rossum, who heads the Diabetes and Obesity Center here at Erasmus Medical Center, and I met in 1998. She had contacted a postdoctoral fellow in my laboratory to come and work with us at the University of Maryland. And I picked her up at the airport, and she spent 8 months with us doing research. And I had never met as bright, as motivated, and as troublesome a young woman who made her way through the streets of Baltimore totally unabashed, on the buses, in spite of my concerns and worries. And I hope we gave her the opportunity, because she certainly gave us the opportunity to learn from her and be taught what an exceptional person she was.
Well, my name is Liesbeth van Rossum. I'm an internist-endocrinologist here in the Erasmus Medical Center. And together with a pediatrician, Erika van der Akker, I initiated here the Obesity Center, CGG, Centrum Gezond Gewicht in Dutch. I was inspired to do obesity research several years ago. Back in '98, I met Professor Andrew Goldberg in Baltimore when I went on a fellowship to the United States. And I learned really how to do scientific research over there. Well, here in the Netherlands, overweight is a big problem, with almost half of the persons are being overweight, 12% even obese. And it's obvious that the current strategies are not good enough for the treatment, and that requires a more personalized approach. I think obesity is very heterogeneous, and that the causes per person are very different. We are always thinking of not eating healthy food, and the exercise is too less to be healthy, but there are more factors like the amount of stress, the amount of sleep, but also how is your metabolism regulated, and your genetic makeup, psychosocial factors. There's so many factors contributing to obesity, and I think it's important to first look at all the contributing factors and then determine which treatment a person needs. So to have a more individualized treatment strategies for obesity. I think the biggest challenge now is to create a new mindset, because we're now focused mostly on an obese person and think of treatment, but not one size fits all. You first have to look at all the causes. So I think it's a challenge to implement first the diagnostics. What are all the contributing factors? And then start thinking of treatment. And then there are so many treatment strategies for obesity, like bariatric surgery or exercise or cognitive behavioral therapy. You have different forms of treatment strategies. And to adjust it to the person, that will be the next challenge after first implementing the diagnostics.
My name is Vincent. I'm a physician and PhD student at the Erasmus Medical Center, and I work at the lab of Liesbeth from Rossum. And my current project is the association between obesity and the stress hormone cortisol. We know now that the cortisol, the stress hormone, is increased on average in the obese individual. And we also know that cortisol increases several complications of obesity, like diabetes, cardiovascular disease. We also know that not everybody who is obese also has a high cortisol level. So we are trying to find out, are the individuals that have high cortisol levels, are they the individuals that also get more disease in the long run? Do they have a harder time losing weight? And can we in fact help them decrease their cortisol levels and make them more healthy? We certainly hope that by investigating cortisol levels and understanding better how cortisol works, that we might get cortisol into the decision making of which treatment would be best for an obese individual, and also to perhaps see if our patients are reacting well to the therapy we offer them, if we can actually decrease their cortisol levels.
My research topic involves the role of cortisol in obesity and obesity-related diseases, because we know that in patients with high cortisol, they most often have also obesity and cardiovascular diseases. And we are now researching if cortisol is also an important factor in the pathogenesis of obesity. And maybe in the future that could be one of the targets we can work on to reduce the obesity prevalence and also the complications which are related to obesity. So we know that obesity is a multifactorial disease, so there are a lot of different things which can cause obesity, and one of the most important things for in the future is to look for each person which is the most important factor which contributes to the pathogenesis of the obesity, and that could be the target we can work on to reduce the rate of obesity.